Excuse me, everyone. We now have our presenters in conference. It is now my pleasure to turn the conference over to Mr. Chris Hunt. Mr. Hunt, you may begin.
Chelsea, thanks so much. Hi, everybody. Welcome to the December 2017 American Hospital Association Team Training Monthly Webinar. We're going to be talking today about enhancing patient engagement using TeamSTEPPS. So I think it's going to be a great conversation. Thank you all for joining. Wherever you are, I've seen folks coming in from Mexico and Norway and Japan, so really love to have that international audience. We really appreciate it. So thanks for joining. Just kind of setting up some rules for engagement for this webinar. Make sure that if you're listening to the audio through your computer through your phone, you want to mute your computer. This will stop having a kind of annoying echo that could happen. We'll be doing a Q&A session at the end of the presentation like we always do, and we'll be definitely using your questions that you chat in throughout the presentation in that Q&A session. However, throughout the course of the presentation, we're really going to try to grab your questions as we go, and our presenter today is very interested in us interrupting her and asking those questions. So as you think of things, please feel free to chat them in, and we'll try to grab you. So looking forward to having a nice question-filled presentation today. Just a little bit on some upcoming team training events here with the American Hospital Association. On January 10th, we have our next webinar, and that's physician engagement in TeamSTEPPS and patient safety, and that's with Dr. John Nunez from the Valley Care Health System out in Southern Oregon. We actually, in the next week, at the end of next week, we're having a TeamSTEPPS Master Training course here in Chicago at the American Hospital Association offices. Registration's still open for this if you want to go over and check it out. This Master Training course is going to focus in on TeamSTEPPS and game theory, and how you could teach and roll out TeamSTEPPS in a very innovative way. So it's with a former webinar speaker from a few months ago, William Gordon from Rosalind Franklin University. So we'd love to see you here. There's still, like I said, a couple slots open, and please feel free to register. In January, we're also going to be opening up and letting people know about courses that are going to be taking place throughout the 2018 calendar year at some of the TeamSTEPPS regional training centers around the country that are part of the AHA team training program. We also have our national conference that's coming up. We're accepting proposals until this Friday at 11 a.m. Central Time. That would be noon Eastern. And there is a whole bunch of information over at ahateamtraining.org about the conference and about kind of the registration fees, and if you're a presenter, their fees are a little cheaper. If you're coming in a group, they're a little cheaper. So come check it out, and we will actually open registration in early 2018. But we're looking forward to seeing you all in lovely San Diego, which sounds great since it's 30 degrees today in Chicago and really, really cold. As always, if you have any questions, please get in touch with us. Our web address is there. Our email address is teamtraining@aha.org, and we have our phone hotline to answer any questions you have. I am now really, really happy to introduce our presenter, Sue Collier, who is the interim vice president here at the Health Research and Educational Trust, which is a part of the American Hospital Association, as well as the clinical quality and content development lead here at the AHA. Sue's somebody that I really enjoy working with. She's got tons of knowledge on this. She is an incredibly empathetic person, somebody that I consider to be a friend, and so I'm very happy to have her today and look forward to hearing from her. So, Sue, I'm tossing it over to you.
Thank you, Chris. And it is indeed exciting to see the variety of people that are on the line and all of the different things that you have planned for the holidays. I hope that today's call will really help frame for you the excitement that I think we can build in our organizations to think about how we engage patients as partners when we are working as leaders to advance teamwork and communication. When planning today's webinar, I thought carefully about what would be a way to really connect this topic in a way that would at least reflect that this is universal. And you can see that on this slide, this is not a typical headshot for a webinar. This is actually a picture that was taken when I was in Guatemala this past summer on a medical mission trip. And this is one of the children in the village, the Mayan village that we were serving. And I wanted to highlight that during this trip, and for those of you that don't know me, I'm a surgery trauma ICU nurse by profession. I began many, many years ago in nursing and in the 80s. And so my background was really one of working in an acute care setting. And over my career, I've had the joy of working in a variety of different settings, from acute to long-term care to post-acute and ambulatory. But I can tell you that I wasn't fully prepared for working in the Mayan jungles. But I will tell you that in the days that we were staffing clinics that had no running water or working toilets, we used the TeamSTEPPS tools, specifically huddles and debriefs, to prepare our team to work with the villagers that we were serving. And I'd like to share, as I go through today's session, some examples of how we modeled the engagement of patients from where they were in their journey of healthcare, and to just emphasize that this work can happen anywhere and in any setting. So for today, I want to start by describing the TeamSTEPPS framework and principles. I'm assuming that most of the folks on this call really have a working knowledge of TeamSTEPPS, but I'm going to give a really high-level framework because I want you to think about the framework and the principles as it relates to patient and family engagement. Then I'm going to give you some specific examples of how 3 of the TeamSTEPPS tools can be adapted to engage patients as team members, and then end with a very kind of high-level overview of some of the barriers that I know from my experience in working and leading patient engagement efforts in a multi-hospital healthcare system as well as at a state and national level. We recognize there are barriers, and there are ways to enhance success in integrating TeamSTEPPS and patient engagement. And I want to cover some of those barriers and give you some solutions to consider. So we're going to start out giving you an overview of the TeamSTEPPS framework and principles. I'm going to talk about some patient and family engagement strategies, so we're getting a shared mental model of what we mean when we talk about patient and family partnerships. Then I'm going to show you an approach to adapting the tools and challenge you to think about ways that you might be able to adapt the TeamSTEPPS tools and strategies as you partner with patients in your organizations. And then I want to talk about some of the challenges and opportunities in any healthcare setting. As I'm going through today's webinar, please feel free to comment in the chat box, talk among yourselves, pose questions, comment on what you're hearing. We want to have this to be a fully interactive session, so your input and your engagement will be essential. So let's just start by providing a very brief overview of the TeamSTEPPS framework in case we do have attendees today who may not be familiar with this information. And I would be especially interested in seeing in the chat box if we have any patient and family advisors that were able to join today. I hope we would. And if that's the case, I hope that this overview will be useful. But for those of you that may need a quick reminder, TeamSTEPPS actually stands for team strategies and tools to enhance performance and patient safety. So strategies and tools to enhance performance and patient safety. It was originally developed by the Department of Defense's Patient Safety Program in collaboration with the Agency for Healthcare Research and Quality. And it's based on over 20 years of research and lessons learned. So it's an evidence-based set of tools for optimizing patient outcomes and doing it by really enhancing teamwork and communication among health professionals. There are a number of ready-to-use materials and a training curriculum that can be used to successfully integrate these principles into any healthcare setting. And the research has shown that by using these strategies, you can increase team awareness and information sharing, and I want you to start to think about the team being more than just the healthcare professionals, but including the patient as an active partner. These materials can also clarify roles and responsibilities, again, thinking about the team as a whole, resolving conflicts, as also eliminating barriers to quality and safety. So as we think about the framework for TeamSTEPPS, this is an important framework because it really covers not only the 4 skills that are key to the TeamSTEPPS model, but it also speaks to what are the outcomes that we want to see in that team. So in the middle of the framework diagram are 4 skills: communication, leadership, situational monitoring, and mutual support. Communication is the process by which we share and exchange information clearly and accurately among team members. So it's very specific to how we share information among all of the participants on the team. Leadership is the ability to ensure that the members understand the actions of the team and how changes in information can be communicated so that everyone has access to the right information at the right time and they all have access to the necessary resources. That's a key role of leadership. Situational monitoring is how we scan and assess a situation so that we gain an understanding and manage what we call kind of an awareness of what's happening among the team. And then mutual support. That's the ability to anticipate the team's needs, and by gathering and sharing knowledge about what's happening in the workload and responsibilities that the team is managing. And all 4 of these skills are connected to the team outcomes that include knowledge, and this is where we get that shared mental model because we all have the same information, we all understand what's happening, and we all are using that information to work together. Also, the outcome of attitudes where we have trust and we have a sense that I'm part of a team and that I understand what the team is focused on. Overall performance is an outcome that's defined by having accurate practice, timely, efficient, and safe practices. So this model is really about the interaction between those 4 skills and those desired outcomes with the intention that the teams all have a shared purpose, and that is to deliver safe, quality care and continuously and to improve. So when we look at the team structure in the TeamSTEPPS model, it's important to see that we recognize that there are lots of people who are involved in this focus on safe and efficient care, and that this pyramid would be incomplete if any one of the member of these teams or individual members were absent. So the pyramid would basically not stand up, or it would not be complete. But notice who is at the top of that pyramid. It's the patient. So when we think about the team structure in this evidence-based framework, it clearly shows that in order for us to improve team performance, we have to think about how we're addressing the patient's continuum of care. This is about recognizing that the team includes and should embrace and integrate the patient as an individual who also needs to have information shared and exchanged, who also has a certain role of leading their care, leading and understanding what their preferences are, that they are also scanning and assessing the situation. So they're doing their own situation monitoring to gain information and understanding so that they can be aware of what they can do to support their team and to be a part of that team. And then the mutual support element as it relates to the team structure is the patient wants the team to be able to anticipate their needs, and they want to be able to figure out what the team needs from them in order to make sure that the focus is on safe and efficient care. So while many of you probably are well familiar with the TeamSTEPPS framework and the team structure, I hope that this very quick overview is helping you think about this in a different way and kind of level setting, because now I want to talk a little bit about the definitions of patient engagement. What do we mean when we talk about patient engagement? And I'll tell you that there are many opportunities to educate individuals on skills in engaging patients as partners, and we're giving you a very brief snapshot today and are interested in, by the end of today's webinar, in helping think through, those that are on the call, how we can develop and offer a more comprehensive and a longer program on this particular topic, because we realize that there are many, many factors and components that go into being successful in engaging the patient as partners in the team. But when we think about patient engagement, there's several definitions in the literature. These are two that I like in particular. One is from the Institute for Patient and Family-Centered Care, where they talk about patient engagement as an approach where we are planning, delivering, and evaluating health care, recognizing that we have to have mutually beneficial partnerships among all players, the providers, the patients, as well as their families. So this definition really gets us to start to think about this process of when we begin to evaluate ways that we can improve teamwork and communication in our organizations. Let's think about how do we engage the patient as a partner in that process, whether we're planning to embed TeamSTEPPS tools and strategies in an organization, or we're adapting them to engage with the patient. We want to engage the patient as part of the planning process, or as we are implementing different strategies, we want the patient to be an active participant in that implementation activity. The other definition I really like was actually published in 2013, so only about 4 years ago. And it's relative to working with patients, families, and health professionals at all levels of a system. So this could be at what I call the intimate or the personal level, which is at the bedside. It could be at a service line or a specialty area focus, like say a cancer center or a surgery division. It could be at a hospital level, and it could be at a community level. So for those of you on the call that may be working in post-acute or in ambulatory settings or in long-term care, this definition really resonates because it recognizes that this partnership can happen anywhere and at any level, and that we can take specific steps to recognize the patient as a co-designer, as a partner in the efforts to improve the way in which we operate as teams. So when we think about patient engagement and TeamSTEPPS, with TeamSTEPPS really being that maniacal focus on improving communication and the way that we work together as members, the Institute of Medicine definition that actually was published over 15 years ago really focuses again on that keyword partnership, and that it acknowledges, this definition acknowledges that patients have the education and the support that they need to make decisions and to participate in their own care. So when we look at that team structure in TeamSTEPPS, we recognize that if the patient is at the top of our pyramid and we have specific teachable, learnable skills that relate to communication, leadership, situation monitoring, and mutual support, that if we want to have the patient be successful as a partner, we have to commit to having the education support that they need. So it's important that as we are moving forward and thinking about how we can adapt the TeamSTEPPS tools to use to engage patients and families, that we start first with patients and we end with patients. So it's critical to acknowledge that this is our shared mental model going forward for this webinar, and as we think about the patient at the top of that pyramid, we recognize that this is, there would be very few people who would look at this slide and say, well, of course they're team members. It's an entirely different conversation than when we start talking about what does that look like and how can we do it. How do we take this conversation from a what do we mean by patient engagement, what do we mean by teachable, learnable skills and teamwork and communication, and why is that important? Hopefully I've shared, at least in very high level, it's important because it's a part of that critical pyramid for success as a team. But then the question becomes, so how do we do it? So let me talk about a few best practices in patient and family-centered care and in engaging patients as active partners. And I know that we got some questions, Abby and Chris and Jen, prior to today's webinar. And some of these questions were participants on today's call who wanted to know how these practices could be embedded across different settings, across different types of patients, across transitions of care. So I'll try to embed some of those suggestions as we move forward. But when I mentioned bedside shift report, this could be a handover in a clinical acute care setting that is typically associated with a bedside, where we're sharing information across shifts or across units. When a patient is essentially when their caregiver is changing, having patients actively involved in that report. Historically, I came from a surgical ICU setting in the 80s where the nurse coming on, I would give report, and I would tell the patient what happened, the nurse what happened with the patient during that evening or day, and I would run through the vital signs, and I would share the drugs that were hung and all the different things to look for and trends. But we didn't always engage the patient, and if the patient wasn't able to be engaged, we didn't always engage the family. So we were duplicating effort when we were trying to share information that was shared across that handover. And when we think about bedside shift report and engaging patients, we have to really remember, again, the patient is part of the team. So wherever and whenever possible, whether you're talking about a handover in a home care setting where there's a physical therapist that may be handing over a routine to a family member, or if we're talking about an ambulatory care setting where a physician is handing over a patient's follow-up for education to a health coach. The concept of a bedside shift report is that whenever we are exchanging information across providers or across settings, talk about how you can engage the patient. Interdisciplinary and safety rounds, whether you are conducting huddles or rounds or debriefs, if there is an opportunity to engage the patient in that, that's a best practice. It recognizes that the rounding or recognition of safety issues that might be impacting the patient's care, whether it's a communication issue or a teamwork issue, wherever possible, to engage the patient in that conversation. Something as simple as sharing patient stories in meetings is a really easy way to acknowledge that the patient is a part of the team and is involved in the exchange of information, the perception of what's happening in terms of mutual support among the team, or it may also give us an enhanced kind of awareness or monitoring of the situation where we are finding out what the patient's scanning and assessing of a situation means when we're looking at how effective we are at working as a team. patient communication boards, whether, again, they're in the ambulatory care setting or in an acute care setting or in other settings, these are ways in which we are saying to the patient, we are not only going to be sharing information and priorities and goals, but we want to make sure that these are your goals and that these are the preferences and the areas of focus that you want the team to work with. So there is a great example of communication where information is clearly and accurately exchanged among all team members, and the patient is actively involved in being a part of sharing information that matters to them. And then last but not least, and this is a huge area that deserves much more time and drill down, but it's engaging patient and family advisors on boards, safety, and quality teams. This is an active way to say we have a team and the patient's voice needs to be part of that team. There are a huge amount of resources and tools and strategies that we've developed within AHA and HRET, as well as that we've partnered with other organizations that we can share in a future training. But this is clearly a best practice that demonstrates that having the voice of the patient actually in the room is a very clear way to integrate the patient as a partner in the team. So I want to share this picture because this is an example that was not a clinical setting, but it's, again, if we have leaders that are working to connect TeamSTEPPS tools and strategies in their organizations, and it's not a direct clinical organization. This is a patient family advisor who participated in a national convening that we invited not only experts in patient and family engagement, but experts in population health, experts in high reliability organizations, and in physician leadership to co-design a strategy for how we might address the needs in the healthcare industry in the future. And this is again another way to demonstrate that the patient is part of the team and that their perspectives, their communication needs, their scan or situation monitoring of the industry can be real-time and actively engaged in the work of demonstrating basically as a team that the team includes the voices of the patient. So I want to pause here and as I ask this question, I'd like for you to chat in the chat box. What is your organization doing to enhance patient engagement? Some of you may say, well, I'm in a TeamSTEPPS leadership role, or I'm in a clinical setting, I'm not really sure. That's okay. Say that. It's not unusual to say that, I don't really know. That's an opportunity for you to think about. How do I find out what my organization is doing to enhance patient engagement? And then tell us what you believe your organization is doing, what you might be involved with. Because I think it would be interesting to hear from the participants on the call today are some other examples of how you are demonstrating the patient at the top of that pyramid. So I'm seeing some folks starting to chat some things in the chat box, and Abby and Chris and Jen, please, call out if I'm missing some things. But I see that Cindy says we're on a high reliability journey, and you have a patient family advisory council. Great. Cindy, give us some additional sense of how that council is supporting your high reliability efforts. It looks like, Kathy, you said you've got patients on your committees. Share with us which committees you have patients on, because in a little bit we're going to ask you to talk about what might be some of the challenges. It looks like, Catherine from Kaiser Permanente, that you're including your patients in TeamSTEPPS training. Excellent. And that you are looking for using your members as simulated patients and simulated-based education. Excellent. That's a wonderful example. And Donna at Palmetto Health says you have a patient family advisor council, and that at your Palmetto Health Children's Hospital, you're also linking this with the individual clinic PFACs. That is an excellent example of that kind of handover where you are recognizing that when we talk about transitions of care, we're talking about the patient is moving across settings, and having the links across those settings is a great way to show that you're focused on the patient's needs and putting the patient at the top of that pyramid, and that team is not isolated to a particular setting. I'm going to say I'm so excited. There's so many comments in the chat box. I'm afraid I might be missing some. I'm going to call out a few others and then ask if I'm missing anything that's major. Please repeat, and we'll try to get to your question. If for some reason today your comments or questions don't get addressed, we will address those in some way, Chris, in a follow-up with our team training site. Is that a fair offer?
Yes, that is definitely a fair offer. We're trying to gather some of the questions while you're looking at the comments. So
okay, great. So there are lots of examples, and it looks like we have a group of participants on today's call that is already far ahead on this journey and are thinking not only about how you're doing engaging patients as partners, but I'm seeing questions of how you can have TeamSTEPPS implemented in clinic settings. We've got an entire curriculum that we could talk to you about in primary care. Also, I see that you have, Michael, you've said patient care boards, patient shift handoffs, multidisciplinary rounds, so you're already doing some of those best practices. Valerie, you're encouraging families to present and participate in multidisciplinary planning rounds. That's excellent. This is a great situation to be in, to have so many comments in the chat box. I'm going to keep moving because I do want to make sure we have some time for sharing with you a specific example of how you can adapt TeamSTEPPS tools to partner with patients. I'm going to take just 3 of the TeamSTEPPS tools. I'm going to take one of the leadership tools, which is brief, huddle, and debrief, one of the communication tools, SBAR, and one of the mutual support tools, KOTTER'S. And for those of you that may not be familiar with TeamSTEPPS, there are tools for each of those 4 teachable, learnable skills. And then we're going to talk about how you can adapt these tools to really be used by the patient and family. So kind of thinking about these tools in another way for you to support the patient's need for education and support. So we're going to start with the leadership tool of brief, huddle, and debrief. So when you look at this particular description, the team events that happen during each of these segments, you're sharing the plan in a brief. You're getting everyone together. You're forming the team. You're being clear about who's doing what. You're establishing expectations. Then in the huddle, you're going to come back together. You're going to say, what did we see happen when we implemented this plan of how we're going to work as a team. We're going to reestablish situational awareness as your day goes on, or as your continuum moves on, and reinforce what plans are in place. And then the debrief is about really going back and saying, how did we do? It's an informal information exchange, but it's designed to help your team think about ways to improve. So let's take this particular leadership skill and let's look at how might you share this with the patient to demonstrate that they can use briefs, huddles, and debriefs. So when you think about briefs, this is where you're sharing the plan. This is where a patient can be encouraged to share what they understand as their plan of care with families and friends. They could do this after bedside shift report. They could do it after multidisciplinary rounds. They could do it after conversation with one of their care providers, their physician or nurse or respiratory therapist. They can do it through various means, whether phone, email, social media, or in person. But you can share exactly this leadership tool and say, here's some ways that you can use it, because we want you to know, if patient X, that we're doing this in our team. We are briefing ourselves every morning. We're getting together. We're talking about our plan. And then we're huddling and we're debriefing because we want to improve. You can do this as well. We want to show you how to use it for your benefit. So in the huddle, this is when a patient might call together their family and friends after there's been a change, or maybe when they're getting ready to be discharged, or there's a transition of care, or they sense that they need some additional emotional support, and they're going to reestablish situational awareness. They're going to reevaluate the plans, and they're going to assess where the plan might need to be adjusted. So again, the patient can see that they can call a huddle. They can call a huddle with the team to say, hey, I don't understand what's happening, or if this has changed, I need to know what you're doing as a team to address this. And then the debrief, if there's a communication breakdown, you can share with the patient. Debriefs are ways to kind of informally talk about what was the misunderstanding, what could we have done differently, how could we have worked together. Again, thinking about not only how the patient could use this among themselves with their own family and friends, but how the patient can use this with the actual clinical team. So this is just one way of many that you could involve patients in not only understanding how they can use the tool among their family and friends, but how they can use the tool with the rest of the team. This would be a great way if you have implemented TeamSTEPPS work in your organization and you feel that you're doing pretty good at the use of briefs, huddles, and debriefs. Bring the patient into those conversations about what you're doing and why you're doing this to improve teamwork and communication. Show them how they can make that a part of their day as well. So SBAR. SBAR is a technique in which we communicate critical information that needs immediate attention, and it's generally related to a specific condition or change or issue that's involving the patient's clinical status. It's a communication tool. So when we think about how might we share SBAR with patients and families? So this is, again, a way that they can communicate in a clear, concise, and complete way when time is of essence. So let's think about one example. A patient presents in a clinical setting. It could be ambulatory. It could be maybe a family member in a long-term care setting or in an acute care setting. Situation and symptoms is a way that we can encourage the patient to describe what you think is happening. Describe what you believe is going on. Give us your perspective of what's happening. And then background is we can even encourage the patient and the family to either write down or verbalize just a brief description of the medical history. What do you think is, in impacting this situation? Or what are the most important things that you want us to understand about your history? The assessment is really getting the patient to articulate, have you had these symptoms before? If so, what happened? What did you do when these symptoms happened? If not, what do you think might be going on? What's your assessment? We believe that your input is valuable. This is part of those 4 teachable, learnable skills: communication and situation monitoring. And then the recommendation end of SBAR is really the patient saying to us, what do you need? What do I need as a patient? What are my immediate needs, whether I'm going home or if I have a critical issue that I'm presenting in this acute care setting? Again, the idea is to acknowledge that SBAR, while we use it within the clinical setting as clinicians to share information, to clarify our assessment, to get shared mental model of what we believe is happening and get to put out recommendations, the patient can use this from their perspective to also be a part of that communication sharing and a part of that situation monitoring and communication. And again, I'm seeing lots of chat in the chat box. I'm so excited to see you talking to each other and sharing some of the things that you're doing. I'm going to talk about one more TeamSTEPPS tool and how the patient can think about this from their perspective, but cuss. It's one of my favorite TeamSTEPPS tools. It's in the category of mutual support, and it's assertive statements. C stands for concern. I am concerned. If I have an issue in the team, I want the team to know I'm concerned about this. U is, if it hasn't been addressed, I'm going to say, you know what? I'm uncomfortable. I think that we need to deal with this, or I need to address this particular concern. It hasn't been addressed, so I'm uncomfortable. And then if it's still not addressed and you believe that it is a critical element to address, then you call the line. You stop the line. You say, this is a safety issue. So that's cussing. That's using assertive statements to communicate within the team. And Valerie, thank you. Who knew cussing could be such an effective tool? I'm from the South, and we don't cuss a lot. So I will tell you, though, when I share this tool with patients and say, use this tool in the clinical setting, I can tell you I have worked with patients who've cussed using this method. And we the team, because we've taught the team how to cuss, to say I'm concerned, I'm uncomfortable, it's a safety issue. When the patient starts to cuss and say, I am concerned, and then they tell us what their concern is, And then if they don't feel it's been addressed, they say, I'm uncomfortable. Those are key words that then the team can pause and pay attention and recognize the patient is part of the team that's saying there's situational awareness. I'm letting you know that I'm putting you on notice as the team, as a part of the team, that you need this information. I want you to know I'm scanning and assessing and I'm uncomfortable and I need your support. I want you to know I'm scared and I want you to be a part of helping me get a solution. So what I've shared with you in just the last few minutes is that these are some very practical, simple ways that you could adapt the tools, some of the tools in TeamSTEPPS, all the tools for use with patients and families. And so when we think about why is this not already happening? If I love to use the phrase, if this were easy, we'd already be doing it. So we know that in the TeamSTEPPS evidence-based work that there are barriers. There are all kinds of barriers. These barriers are the reasons that these tools and strategies are so important in order to bridge our ability to meet those outcomes. So when we look at this diagram and we look at the far left, these are the same barriers that really are keeping us from really engaging the patient as partners. The inconsistencies in recognizing who's on the team, the hierarchy, the conventional thinking, lack of coordination or distractions and fatigue, these are all barriers that are and can be unique to engaging the patient as a partner. These are barriers in this slide that actually I co-developed with a patient advisor in an ambulatory setting, and I think they apply. And I want to walk through these very quickly because I do want to get us to some of what you think some of the barriers are in your organization. So please feel free to chat those in the chat box, but then I want to talk about some solutions before we get to some of our final questions. So when we think about fear and uncertainty, let's remember that people have a reason for their behavior. This is true of teams. This is true of patient behavior. They may just be afraid or unsure. The clinical setting could be stressful. The patient may be uncomfortable about their care. But remember, if they're in their fear and uncertainty can affect their ability to exchange information, to be actively engaged as a partner. So recognizing kind of from the patient's perspective that it's very similar to when we have staff that may be uncertain or fearful, and that's why these tools are so critical. Comprehension and literacy levels. Patients, we have to be mindful of language barriers that can lead to harm if patients don't understand the system or the culture or know who's doing what on the team. They may not have situational awareness of who's managing what aspects. They may have communication challenges due to their culture or language. So this is a way that this barrier you can acknowledge when you're working with language services. How do we recognize that the impact of literacy levels and culture when we're talking about engaging the patients as an active partner? Team communication and interactions. In just a very fast-paced clinical setting, staff need to be mindful of need to pause, answer questions, listen, and demonstrate a commitment to the patient's concerns. That sometimes we perceive that it might take more time and effort, but actually in the long run it saves time. So when we looking at applying the TeamSTEPPS tools among our own health professional team participants, it's the same thing that's true. We save time when we are all on the same page. We have a shared mental model, and we recognize that includes the patient. And then relationships with team members. Most settings, patients may not have an established relationship with staff, and so if it's their first encounter, they may be reluctant to bother the staff, or even if they have a relationship, there may be a level of comfort and concern to call out or highlight a gap or an issue. So it's important to acknowledge that the level of trust and the level of comfort can impact whether or not you're able to really fully engage the patient as a partner. And then I would just say, last but not least, think about your culture and your clinical environment. Has everyone on the team embraced the attitudes, values, and behaviors that reflect the patient as a partner? That, recognizing that when we talk about staff knowledge, skills, and confidence with TeamSTEPPS, it's the same thing with staff knowledge, skills, and confidence with patient engagement practices. So it's important that We, recognize that in order for the patient to be a successful partner, we have to encourage and spend time to help them develop their skills, knowledge, and competence. I see some comments, too. I see you're already noting some of the barriers in your organization. Please keep noting those. So I see a couple of questions. Judy, you said administration is somewhat uncomfortable with transparency. I think that definitely that's a topic that I would love to cover in a more a fuller environment and part of a training that we're planning to have next year to really delve down into some very specific ways to deal with some barriers such as that where there may be some discomfort with transparency. Charles, you said lack of education. Obviously, it would be ideal if education occurred before it's needed. That's a great strategy, especially as we're thinking about integrated delivery systems. Is there a way that your organization can think about sharing information about teamwork and communication with individuals in the community? Robin, you said you were giving a response that you're being diligent in capturing information and interventions. I think that regardless of the cultural and language barriers, Renee and Melissa, you're saying the power dynamic, particularly with patients who are laying in bed or sitting and a physician who stands, you're recognizing some very basic elements when we think about how teams work together and how those power dynamics or even hierarchy can impact comfort level with calling out challenges or calling out concerns. So again, this is incredible input. We definitely have a lot to digest in the chat box, and I'm looking forward to going back and trying to give you some response to not only some of the specific questions, but figuring out a way that we can summarize some of the wonderful feedback that you're giving today. So let's talk very quickly about some overcoming challenges, and I will say that this is one of the areas that we definitely want to cover in a more extensive training next year, and that's giving the opportunity for us to help organizations think about how they can overcome the challenges, whether it's assessing attitudes of staff concerning patients. There's some simple tools that can be used that literally can get right to what are you thinking about the patient as a partner, and how do we use that attitude or that value or that thought to focus on specific skills that staff can develop to gain comfort with the patient in the room as a partner. Just including the patient in the room, I cannot tell you the power of having the patient voice on Teams. I would be surprised if I've missed a comment in the chat box where for those of you that do have patients in the room, it changes the conversation, and it acknowledges that we begin to realize where we may have lost perspective because we didn't have that patient's perspective in our conversations. It gives us a much richer view of the situation, so it really enhances our talent in situation monitoring and our ability to recognize where we can provide mutual support. I see one comment asking if I would speak to the interface of HIPAA and team and patient communication. That could be discussed in an entire day program, but in a nutshell, I would say that many of our assumptions about HIPAA and how it restricts our ability to have these conversations are really just not true. And there are some specific examples. For example, if patients have said, this person at my bedside is my family member and I want them to be part of the conversation, they've given permission for there to be a report out with that person in the room, and that does not violate HIPAA. So I'll just say that has many, many opportunities for additional conversation, and we'll definitely address that in some resources. I think recognizing the impact of cultural preferences, that obviously is another way to overcome some of the challenges, and then asking patients to be part of the discussions when you're using the tools. If you are using a TeamSTEPPS tool around a patient, say, we're using this tool. We found it helps us to communicate better, to have a good understanding of what each other's roles and responsibilities are, and we want you to be a part of that discussion, and we want you to help engage in this conversation as well. These are just some very quick ideas for you to think about overcoming challenges to engaging patients on the team, but this takes time. Most alterations in shared values, even though we think we're doing it, it's really important for us to recognize that it has definitely takes intent and it takes focus, and what we recognize is that it is a journey. It's not a sprint. We need small wins and successes to demonstrate not only what we're doing well, but where we need to improve. And change requires that individuals in leadership positions are on board, and that in many ways, and I say this having been in healthcare for over 35 years, old culture is no longer going to work when we think about the new team, and the new team being complete only when the patient is at the top of that pyramid. One thing that I would encourage you to also think about is if you're leading TeamSTEPPS efforts in your organizations is KOTTER'S 8 stages of change. These 8 stages can also be viewed from the lens of how do we improve the way in which we work as a team and communicate as a team and engage the patient. So each one of these steps, whether it's creating a sense of urgency and selling the need for change, or guiding the team, developing the team to include patients, or having a clear culture of safety and a culture that recognizes the patient as a member of the team, empowering all members to collaborate, use the similar tools, or to track their progress in communication and teamwork as a whole. All of these steps, each of these 8 steps, can be utilized as a guide in your organization to think about ways to take your work in engaging patients as and TeamSTEPPS efforts to the next level. So making teamwork and communication, it seems like a simple thing to say, but it does need to be a priority. And if it's a priority in your organizational planning, if it's a priority in your whether you're leading TeamSTEPPS or you're leading clinical environments, go back and think about, do we have in all aspects at all levels it clear that teamwork and communication with the patient as a part of that team, part of the discussion. So I'd like for you to ask, as we've got about 10 more minutes to today's webinar, and as we're closing in, I'm going to ask Chris and others to help me maybe focus on a couple of the questions that have been posed in the chat box that I can address. But please chat in one thing, just one thing, that you can do after today's webinar to engage patients as team members. Try to think about not something you're already doing, but think about what is something new that maybe has been sparked, an idea that was sparked by reading in the chat box or listening to this content today, because we really want you to think about this from an action standpoint. We've given you the framework and principles high level around TeamSTEPPS and how that supports in many ways patient and family engagement at all levels and all settings. The tools in TeamSTEPPS can be adapted to engage patients as team members that they can use, or we can engage the patient in the conversation actively. We've shown you some examples of how patient and family-centered culture can be a part of your teamwork and communication efforts, and then some examples of ways you might overcome the barriers. Before we get to some of the questions really quick, I do want to say thank you for your leadership. Your leadership matters, and your input today, your participation in the chat box is critical. Chris, any particular questions that may have been repeated, or some that you'd like for me to address before we close out?
Sue, first, thank you so very much for the presentation. It was really phenomenal, and as you could see in the chat, people are really interested in what you had to say and want to be involved in this conversation. So excellent job. I wish we could all give you a round of applause and you could hear it right now. But thank you. There's been a couple questions that have come through about basically how do you reach out to the patients? How do you educate them? Do you give them flyers or pamphlets? Do you educate them before they get into the acute care setting, maybe in their physician's office, or what are the ways that you would recommend going about to actually do this?
Sure. This is going to sound incredibly simple, but if you think about this in the same way that you would think about how do you educate staff, we don't send staff a brochure necessarily to educate
Right.
them on something we want them to practice in the clinical setting. So it's really about relationships. So it's about finding those touch points in which you can relate with the patient through, if possible, one-on-one, or in a way that is meaningful to the patient, the right timing, the right setting. I will just give a quick example at a bedside. I literally, if I am doing bedside shift report, or I'm in a medical office and I'm the patient, and the physician is handing me over to somebody in the lab to explain something that I'm getting, I want there to be an opportunity to say, when we hand over, patients, here's what we do. I want to make sure she has this information about you. Can you add anything else that you'd like for them to know? That is a really simple way at the touch point of personal care. Then when you take it up another level and you think about service lines, so if you were a leader, let's say over a group of team members, let's say over nurses, or you're a leader over, say, a clinical setting, let's say cancer center, think about what are ways that we can bring the patient's voice and perspective into knowing not only what are we doing to enhance teamwork and communication within our troops, whether it's a clinical setting or a professional team focus, and what are ways that patients can be a part of this, or what would the patient say about this, or how can we involve the patient in that conversation. I think the first steps are not to gravitate towards necessarily a pamphlet or a brochure, but gravitate to the existing examples. Utilize the processes, the teams, the settings that you have now. Start small. And if nothing else, go on rounds with seeing patients in whatever setting, if it's long-term care or if it's in a physician practice, and just ask two questions. What have you seen today that demonstrates we're working as a team? What else would you suggest? Use some of the type of kind of debrief questions to gain more information, and then share with the patient, here's some things that we're doing. You may not, if you don't see it, here's some things I want you to look for, because we're doing these things to improve teamwork and communication. That's a really quick answer to a very difficult, very long-winded question, but I hope it's helpful.
I think it is. I think that it seems like good advice to me. And a lot of people commented on, and I've definitely been struck by this before, just the real utility of using SBAR. And I like the way that you kind of switched up the words a little bit with symptoms, I believe, and something like that. It would also be as easy as handing something to somebody in the waiting room and saying, collect your thoughts before you come back. And so none of this stuff, somebody had asked about financial implications. I mean, it's almost nothing. With a lot of TeamSTEPPS, there's at least the training element and getting with your staff to make sure there's a training element, but utilizing this with your patients, this is an easy win for folks, I think.
That's great. And I see Belinda made a comment about the pamphlet reinforcing patient teaching. I think that's great as a reinforcement. That's a wonderful suggestion. I think it should be supplemented or maybe enhanced by those things that we're already doing, either intimate communications or face-to-face conversations. The idea that the issue of SBAR, one thing I would strongly encourage teams to think about is that this is about making sure the patient knows that we're acting as a team and that we're doing things intentionally. We're using tools like SBAR, and by the way, we want you to use it too. Here's some ways you can use it. But it's also that kind of connect the dots that the patient gains confidence that you are working as a team and that you see them as part of the team. Sometimes it's a matter of just reinforcing the patient. We see you as part of the team. If you don't feel that way, let us know what else we can do. But here are things we are doing to make sure you are a part of giving us information, sharing information, know what the plan of care is, and if there are ways that we can do it better, we will. Tara, you were saying 8 times 8 ways. We can't reinforce it enough. That's a great suggestion.
There have been a couple questions beforehand, and I know we're at the end of the time here, but a couple questions that have come through about, making sure that this is translated into different languages, and how do you work with different languages. There's actually also a TeamSTEPPS module, so not a full on TeamSTEPPS suite of tools, but a specific module on working with patients with limited English proficiency. So that's definitely worth a gander for everybody out there. That's not on the AHA Team Training website, but if you go over to that website, there's a link over to other resources, and it's on the TeamSTEPPS website for AHRQ. So easy to find if you travel over there.
I think what I've seen today in the chat box is clearly that we are finding some specific ways that we can reinforce some of our resources, but it also is reinforcing this opportunity to provide a more in-depth training program that would bring some of these issues give us more time to discuss some of these issues. Agreed.
I think that that's something that I hope everybody is interested in, and you could look forward to an offering like that in 2018 so that we could really kind of hone in on some of these elements, because working together, I'm sure we could really make quite a difference on this.
Yes.
Well, thanks, everybody. Thank you all for being incredibly active participants. That's probably one of the best webinars I've seen as far as that goes. And Sue, again, thank you for a fantastic presentation.
Thank you, and thanks to everyone on the call for what you do every day to serve the patients and families.
Thank you, ladies and gentlemen. This concludes today's teleconference. You may now disconnect your phone line and log off of your webinar. Speakers, one moment.